Hello, and welcome to the Smart Injury Doctors Podcast, the injury market's top program for doctors, lawyers, and insurers who want to gain greater insight on how to improve patient recovery results and deliver better services in the U.S. injury market. Please welcome your host, Dr. Jeffrey Allen Kronk.
Okay, doctors, today what I want to talk about is your attitude and your beingness in regards to attorney presentations or when you're trying to communicate with attorneys. So many times across the country, as the head of a spinal ligament testing company called Spinal Kinetics, or of my own Smart Injury Doctors and Smart Injury Lawyers programs, where I have an online training program teaching attorneys and teaching doctors more about these ligament injuries, and specifically teaching doctors about how to present these injuries to attorneys. The biggest thing that I have to say to you is your attitude and beingness are what make or break it. And I know that sounds funny, but like when I walk into an attorney presentation, I already know that the people in the room don't understand. They don't understand spinal injuries. They may be representing the spinal injuries for 10, 15, 20 years in a law office, but if I ask them a simple question, hey, when a spine is injured, how does it derange? They can't answer that question. I know they can't answer that question. If you don't believe me that they can, and remember, a spinal injury, or all injuries, are derangements of a body part, right? So it's literally impossible. I can't damage your arm without deranging some tissue. If it's a skin injury, I'm going to derange the skin. If it's a muscle injury, I'm going to derange the muscle. If it's a tendon injury, I'm going to derange the tendon. If it's a ligament injury, I'm going to derange the ligament. If it's a bone injury, I'm going to derange the bone. It is impossible to damage a human body without deranging it. So it's impossible to damage a human spine without deranging it. Now, just because a law firm has said, well, gosh, I've been representing these cases for 30 years, I still, when I walk in, know that even though they've been representing spinal injuries for a very long time, they don't actually know what they look like. Now, that's like going into a dog bite, and it's no cut. It's an opportunity. It's a great opportunity for me. It creates a market, it creates a niche, and it creates a niche for the doctors that understand how to simply communicate in this market. It's a great niche. But if I went into a law firm and said, hey, what does a dog bite look like? And they couldn't tell you what a dog bite really looks like, you might think, well, gosh, I wonder how they do on their representation of these injuries. In the spinal injury market, the majority of attorneys in the market, and the majority of doctors, quite frankly, in the market, do not know how the spine deranges. And there's only three ways it deranges. There's only two tissues. You got bone and connective tissue. That's all the spine is. It's not the spinal cord, it's not the spinal nerves, it's not the spinal muscles. Those are different parts and different systems. So if you damage the spine, you either damage the bone or the connective tissue. Two types of connective tissue: disc connective tissue, which is picked up on MRI, herniation; non-disc ligament, which is picked up through excessive motion testing on X-ray and a computerized radiographic mensuration analysis. That's how you pick it up. You want to accurately measure for how much excessive motion, excessive translation, or excessive angulation. Now, when I say beingness and attitude, I know that the non-disc ligament injury is one of the most significant injuries with the spine today. And I know there's a lot of people that don't understand it. So when I go in, my attitude and beingness is that of an expert. That of somebody who is highly competent, a highly competent pro, because I understand this condition, I understand these injuries, and I understand how they're missed, and I understand how to simplify them and explain them, right? So the spinal ligament injury is the first, fourth, and sixth leading cause of chronic pain and disability in the market today. If I want to look at the fact that it causes accelerated degenerative change, and I look at degeneration, spinal degeneration, and what is that, I think that's second on the list for chronic pain and disability as a generator. So you could say the first, second, fourth, and sixth, or depending on who you read, it could be different, right? But they're very much so a leading cause of chronic pain and disability. They're also the leading cause, especially in the upper cervical spine, of the symptoms that would be generated that mimic that of a mild traumatic brain injury. So it's very easy to connect the traumatic brain injury to the upper cervical ligament injury. Now, what do I have to explain? It's very easy. I just have to show the attorney. Doctors will actually say, well, my attorney doesn't know what to say to a insurance adjuster. Okay, so my question always is, well, doctor, what should they say to the insurance adjuster? Well, they should say the injury is permanent. Okay, have you explained to them that it's permanent? Well, yeah, they asked me for research on how it's permanent. Good. Have you Google search? Have you done a simple Google search? Just do a simple Google search. Are spinal ligament injuries permanent? Do they cause permanency? See what you get. If you want to really splurge on this, go out to ChatGPT and say, hey, are spinal ligament injuries permanent? Or, hey, ChatGPT, how much excessive motion does there need to be in order for the patient to qualify for spinal fusion surgery? Or, hey, ChatGPT, does spinal ligament injuries actually cause accelerated spinal degeneration? What research do you need? You're going to pull it up. It's all there. It's all there. I already know it's there. So explaining it to an attorney is very easy. Now, I'm not going to say alteration, motion, segment integrity. I'm going to say pre-authorization for spinal fusion surgery. Right? So for those of you that don't know what I mean, there's a thing called alteration, motion, segment integrity. That's what's used in the impairment guidelines, right? So that condition causes, under surgical guidelines, that causes a pre-authorization for spinal fusion surgery. It's a finding that pre-qualifies the patient for that surgery. So when I'm trying to explain something to somebody, first of all, I'm not going in there trying to get approval. What do I need approval on? This is where I say beingness and attitude. I don't need approval on anything that I'm talking about because everything I'm talking about has already been approved. The market, the surgical guidelines, the impairment guidelines, Medscape, ChatGPT, Google searches, simple Google searches have already confirmed everything I'm talking about. So I don't need acceptance. What I'm talking about is so well accepted in the market that it doesn't require acceptance. Now, somebody may have a question on it. Well, gosh, Dr. Crunk, is there any research that shows that spinal ligament injuries are permanent? If an attorney asked me that, I'd say, yeah, just Google search it. Just Google search and say, hey, are spinal ligament injuries permanent? Or go to ChatGPT and say, are spinal ligament injuries permanent? You're going to see right there that, yes, of course they're permanent. Do spinal ligament injuries accelerate degeneration? ChatGPT, yes, it does. So when I'm going out, my attitude and my beingness are the fact that, look, the majority of people that are in these types of injuries have a non-disc spinal ligament injury that's quite significant. I happen to understand it. I understand how to work it up. I understand what the guidelines say about it. I understand what imaging needs to be done. I understand how to work it up. I understand how to document it. I understand how to get the patient better from it. I'm the number one choice that anybody in my market should be going to. My center, my clinic is set up. We specialize in this. Our primary focus is on this. And so that's my presentation. When I'm in with a law office, and I teach my doctors this all the time, guess what? This is the number one cause of both acute and chronic pain. So when I'm in a law office, just to let you all know on a little secret, when I'm in a law office, I already know that they know people that have chronic pain that should be coming into my clinic. So my first referral from a law office might be their staff or somebody that has a chronic condition. And if I help them, then it furthers my relationship with the law firm. I know that when I go into a law firm, right, there's a couple things that I want. One, I want them to understand that a disc herniation unto itself is a pre-existing condition. It's not been validated that it was caused in the accident. I already know that. So I also know that when a law firm does not have a positive MRI, they think they don't have an injury. So I'm going to educate them on how that's not true. So when they go negative MRI, their first choice is, wow, Dr. Kronk, or whoever you are that's doing the presentation, right? I want them to know that the just because the patient if the patient has any other symptom besides pain or radicular complaint, and they have any other symptoms, it's not caused from the disc herniation. I want them to know that. I also want them to know that if their client is not doing well under care, it's because this injury is missed. I also want them to know that this condition ties right into the traumatic brain injury significantly, and it ties it all together. As a matter of fact, it's one of the main drivers. It's a main driver for the chronicity of the condition. And I want them to know that. I want them to understand that. Now, I'm not going to have to explain a lot of different things to them, because guess what? I'm going to follow up. I don't have to explain everything under the sun, moon, and stars. What my finding with the doctors that I've trained throughout the United States is that as doctors, and myself included, man, I'm as guilty of this as anybody, is you try to over-educate. You try to, it's like you're turning on a fire hose and you're giving somebody so much information that it's overwhelming, and you don't need to. The simpler the presentation is, the more powerful it is, the better it is, the more it communicates. But what also communicates is your confidence, your beingness, your competency on your subject. That also really communicates. So if you're going in now, what dictates competency? Well, one is your knowledge. So if you're not knowledgeable, you need to strengthen that. That's why I have a Smart Injury Doctors program. You need to strengthen that, because that alone can cost, in my experience, that can cost practitioners millions and millions of dollars in unearned income that could have been earned. So there's a cost there. I mean, instead of a clinic doing $400,000, they could be doing $800,000 a year. Instead of a clinic doing $500,000 a year, they could be doing $1 million a year. And if they did that for 10 years, and they had 10 years of additional $500,000 in their clinic, that's $5 million worth of additional income that they would have earned that they never would have earned, right? So now, what is, people look and say, well, God, I don't know, it costs $5,000, $6,000 to join these programs. Well, I look at it and say, yes, it's $6,000 to join a program, but if it costs you $5 million not to have the data or the information that would allow you to get the additional $5 million, how much did it really cost you? How expensive is it really? So, when an attorney asks a question, here's a common question. Hey, what is the value of a ligament injury? Good. A lot of doctors struggle with that question. I don't struggle with it at all. As soon as the attorney asks me what's the value of a ligament injury, I'd say you're dealing with every day. What's the value of a disc is a ligament? What's the value of a disc herniation? If a person has a disc herniation, what's the value of it? You know what? They can't tell you what the value of it is. Why can't they tell you what the value of it is? Because it depends. It depends on all of the other circumstances of the person. The injuries are the same. The people that have the injuries are all different. And different circumstances dictate different values. Right? Well, if you start talking about research, let's just talk about the research of the disc. If I want to go out and I want to look at the research of the disc, it published in 2023, just Google search spontaneous regression of spinal discs. 2023, do the discs spontaneously regress? In other words, do they correct themselves? Google search spontaneous disc regression 2023 and pull it up and see what it says. Or does early MRI lead to doubling of disability rates? Just Google search it. It does. Why? Because the disc is not the thing. It's not the main thing. It never has been the main thing. The only thing has the technology of the MRI is an impressive technology, and everybody's gotten enthralled with that technology, and it's great technology, but the disc is not the only thing. It's the other ligaments around the disc that are the significant driver. Or let's do research that says, hey, if I send the same patient to 10 different MRI centers, what's the error rate? So just Google viability and diagnostic error rates of 10 MRI centers. Just Google it. 2016, 43.6 error rate, miss rate, difference rate. So when people are asking me questions, I know my subject so well that I can basically just throw it right back, right? And say, all of a sudden they realize for themselves, they're trying to judge this test, let's say a CRMA, they're trying to judge it by a standard that their other tests don't remotely qualify for. And so it's very, very easy. It's not hard. But if it's not easy for you, then I'll tell you that it can be easy, and that's why we do these programs. We do these programs so I can help you. Reason why I do the spinal smart injury doctors program is so that I can help doctors to ask better questions. If an attorney is asking me a tough question, one of the things, first of all, there are no tough questions. Like, I've been doing this long enough. What's a tough question? I don't know. I haven't heard a tough question in so long. I don't know what a tough question is. Because if you understand the simplicity of your topic, there are no tough questions. There really aren't. As a matter of fact, one of the things that I love about the Smart Injury Doctors program is at the end of every month, the last Thursday of every month, we do Deposition Thursday on our coaching calls. And that's where we just take hard to ask questions, hard to answer questions, and show you just how easy they are to answer, especially when you have the background material. So attorney presentations, in my experience, beingness and your attitude make or break an attorney presentation. And beingness and attitude are your enthusiasm and your understanding of your topic. And so what I find is that a lot of doctors struggle because it's not because they're bad, it's just because they don't fully understand the topic that they're excited about. Or maybe they could get enhanced a little bit more so that they can easily communicate their topic to either an attorney or a 10 or 12-year-old, right? Because you have to make stuff so simple that a 10 or 12-year-old could actually understand it. And when you have it that simple, then it's really powerful. And that is the key. Your attitude, your confidence, your beingness in attorney presentations. Doctors, this is the last podcast I'm doing for 2024. I hope you've all had a very, very good year. I hope this helped you in some way. If you have interest in my program called Smart Injury Doctors Program, just go out to the website, book a call with me. Book a time. You can go right into my schedule. You'll see it's pretty easy to do. You just book a time in with me, and we go over what we have to offer and how it may be able to help you. Other than that, thank you for your time, your attention, what you do, and I look forward to delivering more content on the next podcast.
You've been listening to the Smart Injury Doctors Podcast, the #1 audio production show for professionals in the U.S. injury market that want to deliver better injury services to the patients, clients, or insureds they serve. If you like what you heard today, please leave us a review and don't forget to join us on our next program.